Thank you so much for attending the webinar on Wazee Day, Older Persons Day, that happened on 6th of October 2023. In this video, we want to share with you the key points and actions that participants in this webinar discussed and also agreed on. So when it comes to social work and involvement work with older people, these are the 12 key areas that came out of that webinar. The first point, or the first area that was emphasized in this webinar, was around the role of government in social work and development work with older people. We know very well the family and the community have been very strong providers of care for older people. And the role of government is still, something that is not very, clear, especially in most African countries. So the role of social workers and developmental workers in this, area of social work with older people is to ensure that they strengthen and advocate more for services, that are provided by the government, and for prioritization of social work and developmental work with, with older people. So the role of government should be strengthened, and this is a role that social workers and development workers should engage in advocacy work to ensure government provision of services and support, for older people. And then the second area that the second key point or action area was it was research. We know very well, there is very limited research, limited documentation on the care models, for example, that we have in African context, the philosophies behind these care models for older people, how they are organized, but then also, need for information around caring, caregiving itself, the training needs for caregivers, who should provide this, training, in which model. There is need for research on the developmental models in social work and development work with, with older people, and whose responsibility is to do this research is mostly about the institutions that we have in the African context, where we see that academics who are engaged in research should prioritize also social work and development work with older people, research topics, as well as government and also organizations. We have so many students who do PhDs, and we should encourage them to actually do research in this area of social work with older people, so that we have more information that can guide, our models of care, and also guide government, government interventions. So the third key point that came out of that webinar is around the family-centered approach that is really culturally appropriate, in the African context. So we agreed and had a discussion that the family remains the mainstay of care for older people. Older people in African context love to age in family with their grandchildren around, and also with, with support around. That really suits the African philosophy of Ubuntu and also our African culture values. So that being said, it's very important that government and organizations really work at strengthening families to provide this care for older people. It doesn't make sense for us to insist that older people must age in their families when they are experiencing abuse, neglect in these families. So it's very important that we strengthen these families, we support these families, especially the government and non-government organizations, to be able to provide quality care that these older people deserve or are entitled to as people with human rights. And apart from the family, we know that the community approach is also culturally appropriate for the African context, because it's also fits very well with the African philosophy and ways of being. And as we talked about the government and organizations strengthening the family, we also need a community-centered approach where we develop more community programs, and also we support or strengthen the already existing community-led initiatives. For example, the mutual aid groups that support older people the cultural groups, the cultural-led initiatives, the faith-based initiatives that provide some form of support, for older people. So instead of reinventing the wheel, non-government organizations, as well as organizations nationally and internationally, need to build on those already existing community-led initiatives so that we strengthen, the kind of support and interventions that are available for older people. The fifth area that we touched on in this webinar was around the caregiver's role for older people. Who is caring for older people in our communities, in our families, in our countries? This role needs to really be recognized. And there is also need to recognize the training needs for our caregivers, for older people. We know most people who care for older people are actually like young girls who have dropped out of school. They haven't really most of them haven't really received any training around the care needs and also care provision itself. And so it is very important that as social workers and government and organizations, we must take the initiative to actually recognize caregivers' role and start training. The way we recognize the role done by caregivers is to think about the compensation or the pay, that we give to the caregivers, but then also think about training opportunities, for these caregivers. And we actually talked about caregiving being a profession, us thinking about caregiving in terms of career progression, so that if someone has done a certificate, they could do a diploma and end up doing a degree in caregiving. And the ultimate goal we are looking at is to ensure that all older people at least are being provided with quality care, with caregivers who know exactly what they should be doing in terms of medication, giving medication, in terms of providing that holistic care, spiritual care, exercises, and all that, and all that that is encompassed in providing, care that someone needs. The next key point that we looked at was mental well-being and resilience. And we said there's still need for more, awareness creation. We still need to understand health in its holistic, in a holistic way, which looks at not only the physical health, but also appreciates the mental health and also challenges that stigma and also stereotypes around mental health and well-being. So we need to ensure that the older people receive the physical care that they need, that there is some form of physical activity for older people, that is provided. And then also we need to ensure that there is some form of psychosocial services that address the needs, the mental health and mental health needs, of older people, but also the caregivers. And when you look at social work and developmental work skill gaps, I want us to think about the institutions where we do our teaching. In most of the universities, you find that courses or subjects around social work and development work with older people, or gerontological social work or geriatric social work, are non-existent. And if they exist, maybe these are just elective subjects where a few people just, opt to do the subject. And that means we are churning out professional social workers and development workers who have no skills or who have no knowledge on how to work with older people. And yet it's high likely that any social worker in their career is likely to meet and work with people who are, older. So it is very important that in our training institutions, we review curricula and include subjects where social workers are introduced to social work with older people or gerontological social work, so that whichever whoever goes out, graduates, and is starting to do social work, they at least have skills, the basic skills and knowledge, that is needed. And we also touched on the importance of establishing community centers, daycare centers, and also halfway homes to provide some form of respite for the caregivers, where caregivers can have some time off that will improve their mental health and well-being, but still ensure that the older people are still taken care of. And this is the role that communities and government should initiate and also maintain in establishing these, these centers. So there is also need to establish, psychosocial services. And we gave here some examples like the friendship bench model, where grandmothers are used in providing counseling services to people with mental health. So there you're drawing on the strength of older people to provide some form of services. And this is work that they naturally do as older people. But then also work that is done in support groups, for older people, work done by worksheds, for example, where there's space for older people to address the social isolation. And we are saying also training institutions need to develop and review training for older people's, service providers. And this includes social workers, development workers, counselors, community workers, geriatric or gerontological social workers, culture workers, and also religious leaders. Skilling these people who are already providing some form of services, for the older people would be, would go a long way, at least in providing, some psychosocial services that are quality, and from skilled people. So at a much structural and broader level, we have the work that is being done by, organizations and bodies like African Union and also regional bodies. They are developing continental policy work, and we need to ensure that also these bodies like African Union stay, very strong in ensuring that our governments are accountable in providing support and services, for older people. And also, we need to ensure that our education, as well as social work and social development education and training, aligns or also incorporates these policies that the regional bodies, policies and plans that they have developed. So the issue of resources, it's always also about the money. Where do we get the money to build centers, to build daycare centers, or to do new curricula, review curricula, and also develop new curricula, to establish psychosocial services, or strengthen families, or do research? It's always about resources. Who is going to pay for training, for the training needs of, of caregivers, of older people? We talked about, in this webinar, we talked about the importance of looking within our communities, our families, our organizations, our government, looking within and starting with the resources that we have. We know very well that the donor funding from mostly these Western countries comes with a lot of conditionalities. It comes with a lot of, they impose on us their procedures, their ways of doing things. And, we know very well there's an African proverb that if you have your hand in someone else's pocket, you must move when they move. So we need to look within, to start with the little resources that we have, so that we can, design most of these services, that would be needed by older people, engage in research, engage in develop centers, that older people can benefit from. And lastly, we looked at, the importance of taking a developmental approach as opposed to the welfare approach in social work and development work with older people. There's need to engage in interventions that address or improve the economic means and livelihoods of whoever is involved in care, in the care for older people, as opposed to just giving people money or just giving them, finances, as some form of welfare. So you can cite this, this work, and we appreciate the role of the ASWA, Association of Schools of Social Work in Africa, which I'm representing as the General Secretary General, and also the role that has been done by Africa Social Work and Development Network that, Dr. Rogare Mugumbate represents. So this is how you can cite this video. We want to thank so much the presenters, our guest speakers, Professor Uzoma Okoye and Dr. Diana Nabumba, for spending time and sharing with us their knowledge, but also the participants of this webinar who really engaged in very, very fantastic discussions and are doing fantastic work in this area of social work and development work with older people. Thank you so much. And once again, my name is Dr. Charlotte Tusasiirwe. Thank you so much for listening to this video.